First time at the AMEE conference, right? What do you enjoy the most about this meeting?
So what I enjoy the most has been seeing how many people have been from different countries. I'm a medical student, so for me, seeing other countries' medical students, I'm from Cyprus, and we see only medical students from Cyprus there. And I feel this conference lets people interact from different backgrounds and different styles of medical school. And I think that interaction and different ideas about medical education has been the best part. And I feel people bring a lot of ideas about medical education, different research, different ways of how people do things in different countries. So I think that's the most impressive for me, and meeting new people.
How did you enjoy the conference so far this year?
It's been great because I'm meeting a lot of experts again. I've done workshops that I really appreciated to share different experiences. I come from the Netherlands and we do a lot of stuff about EPAs, and I had the opportunity to give a workshop, which was very nice to share my experience. And I've been attending other workshops to hear their experience.
So this is my first AMEE conference, and it's a little bit overwhelming. There's so many different things that you could do, but I found that there's so much also to learn and so many people to make contacts with and interact with, that it's been an amazing experience for a newbie like me, despite my gray hair. So I've been learning a lot, and I really have appreciated the organization of the whole thing. Actually, it's one of the best conferences I've been to. So I really enjoyed it. Yes.
How do you find the AMEE conference in Basel this year?
It's been great. It's been really good to just have the opportunity to talk to so many people from different backgrounds, different countries, just to hear about some of the common challenges, but also some of the common sort of themes that are there in medical education. I've enjoyed it so far.
Okay. What did you like the most so far?
The plenary speakers have been excellent, each of the three different in their own way, different ideas, different philosophies, different inspirations, but just mainly the opportunities to meet people and talk to people.
Why do you keep coming back to AMEE?
Because this is the one place in the world where you can see a bunch of people that are motivated to change medical education, so that way we create really good clinicians, students, and eventually impact patient care. Like, I've never seen people so passionate about changing and producing a really good quality education for medical students, and it helps my school because my professors and deans, they come here and they learn and they take back that information and then they change the school. Like, I was here last year and I've seen already a lot of changes that happened from the presentations that they watched, and I'm looking forward to what happens in the future.
So, do you want to work in medical education in the future?
Yes, I would love to work in medical education. Me and my partner, Aaron Brown, we developed an app while we're in medical school to help students, and we're going to continue to always kind of push the envelope, and because I believe like the best people to influence medical education are the people that are experiencing it in the moment. So yeah, I would love to work in medical education in the future.
I think that even though it's quite large, you can find little niches, and the workshops in particular that I've been to, or the roundtable discussions that I've been to, allow that interaction among a handful of people, really, like 20 or so people. So even though it's so big and there's so many people here, there are venues that allow us to meet with similar interests and be able to speak. And so you're not always in this large conference hall and feel very shy about asking questions and talking to the speakers. So that's what I really enjoyed about this. I really like that aspect of this conference.
How do you find the conference this year in Basel?
Oh, it's beautiful. Basel, the city, is so tranquil, peaceful. Everyone's been so kind to us. And the conference itself has really been eye-opening. I think that the great thing about all these educators coming together and talking about issues is new ideas come out of that. And I think that AMEE provides a spark that many other medical conferences like this one don't. So I'm loving it so far, yeah.
So what do you find for yourself, particularly interesting in medical education or in the conference itself?
Sure, so I'm mostly focused on, I love new technologies. And I love learning the ways that we can make those new technologies palatable for educators. Sometimes when new technologies come out, people are a little bit resistant to change, and so I'm really interested in the new technologies and ways we can make those technologies, implement them in our schools. Yeah.
What brings you back to the AMEE conferences?
Oh, I always find AMEE a really useful place. I always learn something new. I meet people I know and people I don't know. It's a great way in which to continue to develop an interest in medical education, because as well as something new, you can always find ways to improve and then take some messages back to where you're working and encourage your colleagues as well.
How did you find yourself involved with medical education?
Oh, well, I started off, I trained as a pediatrician, and in working in pediatrics, I very quickly realized I needed to help in training other people as well, so I became involved in postgraduate training, and then I was also employed by the university, so I was involved in undergraduate, and just gradually I became more and more involved, and then when I retired from clinical practice, I'm now doing this really all of the time.
Started about 4 or 5 years ago. I got to know colleagues in School of Medicine, School of Social Work at Queen's. We developed a collaborative training course where my students work with their students, and we focus really on scenario-based education, simulation, involving human factors.
Okay, and how did you find yourself at AMEE?
Well, I co-convened a workshop on Saturday with Jerry Gorman and Deborah Nestel, Nancy McNaughton. Went very well. It's interesting to see how all these different disciplines work together, particularly in terms of simulation training in medicine.
Okay, something that grasped your particular attention at the AMEE conference?
It seems to be increasingly diverse things are becoming in terms of collaborative possibilities for education.
The interesting thing is the variation of medical education from all over the world. The same aim is to produce the best medical doctor. However, the tool of each countries may be not quite the same, but that is the same aim.
Okay. And how do you find the conference this year?
I find conference is very interesting, and what does it call? Make us to become more better the educator. A lot of plenary section is very best, I think.
The faculty invite me to the conference because I love in medical education, especially medical education research. So I go to review the session in the conference, and there's some session that interesting me.
Okay. So what are interesting sessions for you?
My interesting session is about student stress and burnout and student mistreatment.
Okay. Why do you find this topic interesting?
Because there are big prevalence of student stress in Thailand and also other countries. So I would like to go into the session and find some knowledge to develop the faculty.
Which were the most interesting sessions you attended this AMEE?
I think perhaps not the most interesting, but the most important one was the symposium this morning about mind-body medicine, and really talking about the big problem that we have within among medical students and among physicians with high prevalences of burnout, and how to actually work against that. So I think that's really good that we here at AMEE really puts emphasis on that. Since I know that we have really big problems with this in Sweden, for example, so where they don't speak about this that much. So I really think that this is really important for AMEE to speak about.
And how do you find the meeting overall, the conference?
I find it first and foremost inspiring. I think that may be like the first word that comes to mind when we speak about AMEE, since there's so many people who share like this ambition or love for or passion for education and making it better
and actually preparing our medical students for the future and the future challenges that lie ahead.